How you doing, guys? Dr. Thompson here with Exemplified Health Center of Wellness Way affiliates, Yorkville, Illinois. I'll have to go back and edit that. Anyway, as I was saying, guys, what I'm going to go over with you tonight is I'm going to go over with you some blood work post Johnson & Johnson vaccine. I'm going to give you a little bit of a backstory in regards to this individual. I'm going to show you the findings that we have found on blood work. I'm going to go over with you really why that happened. And I'm actually going to show you why even the manufacturer and the CDC actually is looking into this. But the reality is they should have seen this coming if they're actually showing their trials, because this would have been clearly evident within their trials. Okay. Let me give you a little bit of backstory in regards to this individual, because it does break my heart in order to see, people suffering when they don't need to suffer. But this individual, late 30s, got the J&J vaccine back in May, and then 3 weeks later started to have some pretty crazy symptoms in regards to actual stroke symptoms. Okay. Started to have problems with loss of motor function in the face. Started to see some issues with having a lot of mental confusion going on. And doctors did all kinds of tests. Never really told the patient that this was an actual stroke, even though you just do some basic testing and it's pretty clear that something happened. There was some kind of cardiovascular event that affected the cranial nerves and also affected the brain. When this individual came in, I could see like clear as day that there were some issues with like facial paralysis going on. There was like tears coming out of nowhere. Had basically loss of a lot of like mental acuity, and also had a loss of mental coordination. And so we just basically, guys, did some cranial nerve testing, did some balance testing to check out basically brain function, and it was pretty clear that something had happened. I asked this person, because when she came in, the doctors had diagnosed her with early onset dementia. Okay, let me say that again: early onset dementia at 39 years of age, if you could imagine that. That's not supposed to happen at 39 years of age. So, I looked at this individual and I said, I think you've had a stroke. When did this happen? And, she said it happened, on this date. And I said, well, had you had any kind of vaccines or anything like that? She said, well, I had gotten the Johnson & Johnson one about 3 weeks prior. So it was pretty evident just by doing some basic cranial nerve testing that something wasn't right. So I said, okay, well, if this is happening because it came out of nowhere, you're not supposed to have early onset dementia at 39 years of age. And we just started digging and say, hey, let's go ahead and let's run some labs. Let's see what's going on. Guys, we even took x-rays. Her neck was an absolute mess, a disaster. All of this contributes to physical, mental, chemical type of stressors that were going on. So we went and did some blood work, and we started looking at things from a little bit different perspective in order to be able to see, is this in fact actually going on? So I'm going to go ahead and bring up the screen, and I'm going to show you, some of the abnormal testing in a 39-year-old woman, okay, which I don't see this on a regular basis. So let's see if we can actually bring this up. And let me see. There we go. All right. So I want to point out just a couple of things. You can see I've actually highlighted this. The first thing that we saw was her platelet counts. So, excuse me, platelet counts were through the roof. So 484. Guys, if you look at basic blood work and you see that someone's got elevated platelets, they are always inflamed. Okay. And this is going to be the theme the whole time is inflamed, inflamed, inflamed. So you can see a high level of platelets. And what do platelets do? Platelets are involved in blood clotting. Okay. So higher the platelets, more likely you are to have some kind of cerebral vascular event or cardiovascular event, because the blood becomes a lot easier in order to start to clot. Okay. Now, the other thing too is you start looking at her like different types of white blood cells. One of the things that was through the roof are called granulocytes. I've done videos on this before of people who have high granulocytes. I see people, granulocytes are basically white blood cells that are involved in tissue damage. So this person, just by looking at this, is inflamed. This person has had a lot of tissue damage. And anytime, guys, when we see people with autoimmunity. Doctors don't know how to figure it out. I've seen people who have brought me blood tests for 5-6 years consistently, and all you see is high granulocytes, high granulocytes. In fact, we just had a woman had high granulocytes, this type of basically white blood cell, for 11 years consecutively, and Mayo Clinic couldn't figure out, why. In fact, in the first time in 11 years, her granulocytes are actually down to normal. Why? Because we handle inflammation, and there is no need for those specific cells to actually increase. So you're seeing inflammation. You can also see she's pre-diabetic. Now, she probably was pre-diabetic even before, having this. But guys, this goes back to this one size fits all approach to doing what. Doctors aren't measuring any of this prior to giving medical advice that is a one size fits all approach. So you can see she's pre-diabetic. And guys, I want to tell you something, is that if someone is pre-diabetic, they are always going to be inflamed. And in fact, this pandemic is a pandemic of the inflamed. I don't care if, no matter what you think about the virus, two people can get the same virus. One's fine, one ends up in the hospital. It's the same virus. What's the difference? It is the strength of the host. And you are a weaker host if you have high blood sugar. You're a weaker host if you are inflamed. And guys, any virus can cause a really bad day. So you can see high triglycerides, which is an indication of poor fat metabolism, problems with liver metabolism as well. But here's what's interesting is when you look at this, there's two other markers, okay? Two other markers that you can see. So I want to show you this one here, and this is called C-reactive protein, okay? C-reactive protein. Now, you should be under 1. This individual is at 17. This is the second highest I've ever seen it. I've seen someone at 28, and this person was extremely inflamed as well. But C-reactive protein is a protein made by the liver, and it's in response to tissue damage or infection. So anytime that we see this happening this high, this person, again, very inflamed. There is cell death. There's cell damage that's occurring somewhere. Sometimes they have gastrointestinal infections that are going on. But a lot of times, guys, this is a cardiac marker for cerebrovascular accidents or for heart attacks. And again, this person is, again, 39 years of age. And then the last thing that you actually see is that you can see that her vitamin D levels are absolutely in the toilet. All right. Now, listen, I understand that I am a doctor, but sometimes I just like to say in the toilet or tanked or things like that. I know that some of you have a hard time believing that a doctor can say that, but you know what? Sometimes I just tell it how it is. So her vitamin D levels are absolutely horrible. And my guess is, I always want to say, who's the doctor taking care of? Who's testing it? Who's giving a one-size-fits-all approach? Because now you have a 39-year-old woman who's suffering early onset dementia, and this is her testing after having the Johnson & Johnson vaccine. The reason why I say this, guys, is because my goodness, you shouldn't have early onset dementia at 39 years of age. I don't care how bad your blood sugar is or how inflamed that you are. You don't see that happening. But the doctors who diagnosed that with her actually put her on dementia medication. Okay, let me say that again. They put her on dementia medication, and that was their answer. That was their solution to doing that. So, guys, looking at this is very, very high inflammatory markers that are going on. And so there's something happening inside of her body. And I'm going to go ahead. I'm going to change this just a little bit because there's a couple other things I want to show you as well. Okay. So look at this. This is what we see going on. Okay. So we see a 39-year-old woman with high inflammation who's pre-diabetic, low vitamin D. But here's the other thing too, is that this woman is on birth control. Okay. Guys, you don't have to look very far to know that one of the side effects is that when we're indiscriminately giving women birth control, one of the side effects is actually having strokes. Okay. Now, you combine all of this of high inflammation, pre-diabetic, having low vitamin D, and being on birth control at the same time. It's no wonder that this individual had a side effect. It had a side effect of being on the vaccine. But the problem is, and the sad thing is, this is the first time this patient is seeing these testing. She's never seen any of these testing. And the reason why is because the doctors refuse to acknowledge that this could actually be a side effect. Now, this just boggles my mind because any doctor worth their weight in salt would know that, yes, this is a side effect, but they refuse to actually acknowledge it because it doesn't fit the narrative. So meanwhile, this person, by the time they came to me, meanwhile, this person has suffered tremendously and has actually been denied any kind of proper care only for the fact they wouldn't actually acknowledge that this was a side effect of the vaccine. Okay. Now, let me ask you guys a question because I want you guys to put this in the comments. Please put this in the comments. Go ahead and put in the comments if you know someone who has suffered some kind of blood clotting or some kind of cerebral vascular accident, or even having myocarditis or pericarditis from as a result of the you know what. Because I can tell you guys, they say that it is rare, but I know, people in my own life who decided to do it, and I talk to people every single day who say, yep, I have a friend, yep, I know someone who this happened to, yep, this happened to my brother-in-law. And so, guys, the reason why they say it's so rare is because it's not reported. And I just showed you an example of that. So put a comment if you know someone who has been injured. We need to start telling people that this is happening, because if we don't, and we don't tell people the other side of the story, then this is not informed consent. It's not informed consent if you don't know the risks and if they're not willing to actually acknowledge the risk. So here's the thing. If you look at this comes from Yale Medicine, and Yale Medicine just came out with this. This was December 17th, 2021. They said the link between J&J's COVID vaccine and blood clots, what you need to know. Now, I guarantee you guys on this video is that Facebook's going to put a fact check on this, and they're going to say disinformation, misinformation, because I've had actually 2 Facebook fact checking websites do hit pieces on me. And here's the thing. I don't care. I don't care, because you know what? Go ahead and fact check me, and guess what? It's going to make everybody a lot more curious. So Yale Medicine says there is a link between the COVID vaccine and blood clots. So they are looking into this, and not only Yale Medicine is looking into this, but this came from Newsweek. This was Newsweek, November 2nd, 2021. Johnson & Johnson COVID vaccine recipients almost 4 times as likely to get blood clots. This was a study. Now, they did this study in one county in Minnesota, and here's what they found at the Mayo Clinic. So what they say is this, guys, the study by the Mayo Clinic found that recipients of the Johnson & Johnson vaccine, officially designated as Janssen, were about 3.7 times more likely to develop a certain variety of cerebral blood clots. Okay, here's what they said. The study noted that the risk of developing the blood clots was found to be noticeably higher in women. Guys, I wonder why. Because, guys, you will see young women have cerebral vascular accidents or strokes due to blood clots or due to bleeding. There's 2 different types of strokes, and a lot of it can be related to being on birth control. So my question is are the ladies who are the most affected, are they on birth control? Do they have a high inflammatory environment? And not only that, are they having blood sugar issues? Because, if they have already elevated platelets, high C-reactive protein, then injecting something and bypassing the barriers is going to create a very bad day. And in just a second, I'm actually going to show you why this affects the vascular system so much, and it's going to make sense to you. So they found it was noticeably higher in women. Female recipients of the Johnson & Johnson vaccine observed in a study were around 5.1 times more likely to have the side effect compared to pre-pandemic numbers. So 5.5 time increase that they are seeing in blood clots in particularly women in 40 to 49 and in women aged 30 to 39. Guys, 5 times more likely than pre-pandemic numbers. Here's what's interesting is that you are seeing athletes, you are seeing young kids. In fact, I just heard one from a patient today of young people having myocarditis and pericarditis. And I'm going to show you why, guys, in just a second. But you look on the news and you see that they're trying to normalize now heart attacks in young people. Guys, this is never normal. I don't care how old you are. A stroke, a heart attack is never normal. Just because it's common doesn't mean it's normal. Guys, if I go into Chicago right now and it's 2 o'clock in the morning and I have a roll of $100 bills, chances are I probably would get mugged. It is common, yes, but it is still never normal. And I don't know what happened that we are now just normalizing things just because they're becoming so common. Guys, sickness, illness, and disease in the United States has become so common that we now think that it's in fact normal. So here's what the CDC says, because the CDC says this, we're going to go ahead, we're going to take a look at this. So back in December, they actually met, and the CDC advisors, they weighed the limits on Johnson & Johnson vaccine because of continued blood clot issues, okay? Continued issues. Now, they said that it happens so rarely, about 1 in 100,000. And I'm saying, I don't believe that. I don't believe that for a second, because, I have seen it happen. People have told me that it's happened. I have seen firsthand that it happens. And so I refuse to believe that it is 1 in 100,000. Guys, this is so underreported that it's absolutely nuts. Now, why does this happen? Because people will ask me all the time, why does someone have myocarditis, pericarditis? Why does someone have changes when it comes to their menstrual cycle? Why does someone have gastrointestinal issues? Why does someone, have issues with the brain? Why is someone, having problems with their vascular system? And I'm going to show you why, guys, because COVID-19 spike protein needs a way to get into the body. And how it gets into the body is this right here. This is called ACE2 receptors, okay? You have all of these tissues within your body. They're ACE2 receptors. Anything that you see in the green, it has ACE2 receptor expression, which means that the virus can attach and enter into the cells with any cells that have these ACE2 receptors. So where are they located? They're located in the brain, located in the eyes, nasal cavities, oral cavity, the thyroid gland. Now look at this, the heart and blood vessels, the liver, gallbladder, the stomach, the pancreas, the intestines, the female reproductive organs, the male reproductive organs, and also in the skin. These are all cells that have ACE2 expression, which means they potentially are places in which the spike protein can attach to and infect cells. Now, here's the thing. If you go back to immunology, basic immunology, just think of this, is that the body wants to fight the battle in the barriers. And so COVID-19 is a respiratory virus, which means it enters in through the nose and goes into the lungs, where the body wants within the lung tissue, and it should stay there within the barrier. Now, once it gets really bad, it can then become systemic. So even for a natural COVID-19 infection, then it can become systemic, especially with people who have poor barrier function, who have a poor innate immune system, and they're now going to have to rely on their adaptive immune system to kick into overdrive. But the infection is supposed to stay at the level of the barriers within the lungs. I want you to think of something. What are we doing with Moderna, Pfizer, Johnson & Johnson? We are inserting a spike protein by bypassing the lung barriers and then inserting it into the body, which goes against any kind of immunological textbook. So think of this, is that if that then becomes systemic and you put that spike protein and then it actually attaches to the heart or attaches to the vascular system, let me ask you a question. If that spike protein attaches there, you're going to have an inflammatory response. So can it, in fact, start to inflame heart tissue? Can it inflame what's known as the endothelial tissue, which is the lining of the blood vessels? Can it actually inflame the ovaries or the uterus and cause an inflammatory response? And guys, if it's happening in the vascular system or if it's happening in the heart, are you going to have inflammation? Are you going to have swelling? And think of just the heart. The heart it has a sac that it sits in. So if that heart gets inflamed, it will not be able to beat as hard. And so now you take an athlete who's not like 95% of Americans who aren't elevating their heart rate literally ever. And you have an athlete that is going full out, that's elevating their heart rate at a very high amount. And just think of that heart that cannot beat, that cannot expand because it's inflamed and it's swollen. And guys, you don't have to look very far of seeing athletes who are mysteriously dropping dead or getting severely injured. while they are stressing their heart by sports activity. But guys, when you look at what happens to the vascular system, when the vascular system gets inflamed, then you're much more likely to suffer a blood clot. Now you take a person with an inflamed vascular system. Now you take a person with elevated platelets, you take a person with high C-reactive protein, and it is a recipe at 39 years of age to have a cerebral vascular accident. That affects cranial nerve function, that affects the brain. And unfortunately, this person's life has turned completely upside down. Now, let me ask you a question. Are we taking care of this person? Yes. We're doing everything that we can in order to reestablish new neurology. We're doing everything we can in order to lower the inflammatory triggers. We're doing everything we can in order to help give this person's life back, because she's got 2 kids at home. And in fact, I just saw the little one and my heart broke. My heart broke that this is happening, that this is being denied, that this is not even being talked about within the mainstream media. It breaks my heart that this video will probably get banned, or at least will get shadow banned at work at best. It breaks my heart that we're not willing to have these conversations. And it breaks my heart that there's a lot of doctors who aren't willing to have this conversation and who aren't willing to speak up. So we're doing everything we can in order to help get this person's life back. But guys, what it comes down to is it comes down to this, okay? It comes down to this, is take care of your body so that you can handle any virus. See, this was a pandemic of the inflamed. It really was. Now, I spelled this wrong. I apologize. I'm in full-time practice. I had to, throw this together pretty quickly. So it's supposed to say spike proteins. So spike proteins, they don't belong in the body. They don't belong systemically. They should stay at the site of the infection, which are your barriers, guys. And if you understand the immune system is designed to fight the battle at the level of the barriers. It's designed to fight the battle at the GI barrier. It's designed to fight the battle within the lung barrier. It's designed to fight the battle at the barrier of the skin. It's designed to fight the battle there. But what are we doing that doesn't make sense? We are bypassing the barriers with foreign proteins, and now we are seeing the result of doing that. Guys, just look at immunology and see that we're doing things completely backwards. So guys, right now, this is my opinion. I'm going to give you what my opinion is that this was a pandemic of the inflamed. Okay, the people who have chronic systemic inflammation, and right now we have a pandemic of the vaccinated. That is my opinion. You can agree, you can disagree, but just be respectful. So guys, it really comes down to health. It comes down to this, is that first and foremost, you have to realize what are your inflammatory triggers. You have to start removing that. The body will not heal unless you remove the inflammatory triggers. And once you remove the inflammatory triggers, it is then and only then can you start to restore and start to rebuild the body. See, a lot of you're trying to rebuild your body and you don't know what your inflammatory triggers are. And it's no different than you falling down, skinning your knee, and then the next day you fall down, you skin your knee. And the next day you fall down, you skin your knee. And a year later, you can't figure out why you still have a skin knee. The first thing that you have to do is stop tripping over the buckle in the sidewalk and stop skinning your knee all the time. You have to handle the inflammatory triggers first. And it is then and only then, once you have lowered inflammation, will the body be able to be recovered, to be able to restore, and to start rebuilding the body at that point. Now, we're going to do our best to help this woman. And by the way, I've gotten hundreds and hundreds of emails from people who are in the same boat, and it breaks my heart. And I have to say something. I really do. This is why coming up in a couple of weeks, I'll be speaking with Dr. Peter McCullough at an event. He's another doctor who has stood up. But we have a lot of people who are standing up. And I'm going to ask you this. I want you to stand up. Please don't make me do all the work. I want you to start standing up. So how are you going to stand up? You can do something just as little as sharing this video. You can do something that small and you can make a difference in other people's lives. So please share this video. Please talk to people. Please start taking care of your body. My whole goal is I tell people I want to be able to take care of you so that you don't need my help down the road. And if you guys do that, nothing makes me happier. That's what my mission is in life and in practice. Start taking care of yourself. Find a wellness way doctor and start working with them. And it's hard. It's not easy, but nothing worthwhile ever is. So guys, I hope that you found value with what I just went over. And again, please share it. And I hope you guys have an awesome rest of your night. Hope you have an awesome rest of your week. I'll probably be jumping on maybe Wednesday, Thursday, if we have something new to go over with you. But I hope you guys have an awesome night. I hope you guys stay well and be blessed. We will talk to you guys very soon.